Good morning. Welcome to Active Aging with Barb. My name is Barb Eisenberg. I'm a physical therapist assistant and also a certified massage therapist. I work with Therapy at Home. We're a therapy provider of physical, occupational, and also speech therapy. So I hope you'll check out our website. We're at tahcares.com. So find out what we do and hopefully we can help you. We've been talking about, in the last couple of videos, making positive changes in the new year. We talked about hydration. I've got my water bottle here, so I hope you continue to drink and nourish your body, hydrate all of the cells in your body so they can work at their optimal level. I'm sure you'll feel better, and I hope you'll notice that. We also talked about home safety. I talked about a accident in my own home. I didn't have the walkways cleared. I had a box in the hallway, and I avoided it for weeks and weeks, and then finally I just bashed my toe. Very painful, still recovering, but getting better. So clear those pathways. Make sure you don't have an accident like I did. But today we're talking about arthritis. Why? Because arthritis is the leading cause of pain and also of disability, worldwide actually. So it's a huge problem, and we want to learn about it and find out how we can manage it and treat it. There's many different types of arthritis. There's rheumatoid arthritis, osteoarthritis. Gout is also a form of arthritis. Something called psoriatic arthritis that's associated with psoriasis. There is lupus, and there's fibromyalgia syndrome. There's a few others, but the most common that we'll talk about today are osteoarthritis and rheumatoid arthritis. So I'll be talking about both of these, comparing them a little bit, and then we'll talk about how to manage and treat them. Because even though they're different, they have a lot of similarities in how we manage them. So with osteoarthritis, it usually occurs after the age of 40. With rheumatoid arthritis, it usually happens between the age of 15 and 50, so there's a pretty wide length of time that you could develop it. Usually with osteoarthritis, it's a slow progression over years. With rheumatoid arthritis, it could happen fairly suddenly over weeks or months. With osteoarthritis, it's often the result of stress on the joints, so maybe a repetitive motion or job activity that you do or a sport that you do over years. With rheumatoid arthritis, there's a genetic component, and it's also considered an autoimmune disease. So it's a process where your body is attacking itself. With osteoarthritis, it's a degradation of the joint, the cartilage in your joint, and that acts as a cushion, and it also helps make that connection between two bones more seamless. That's filling the spaces. So the cartilage degrades over time, and sometimes bone spurs will develop because your body is kind of trying to stabilize that joint. With rheumatoid arthritis, it's inflammation in the joint, and specifically inflammation in the synovial membrane and the joint capsule. So with osteoarthritis, it usually only affects a few joints. With rheumatoid arthritis, it often affects many joints, so possibly spine, shoulders, hands, feet, and you'll often see some deformity of the joint. I've seen pictures that are very startling, the deformity that happens sometimes. With both of these conditions, you usually have some stiffness in the morning. With osteoarthritis, it usually usually feels better after about 30 minutes of moving around in the morning. With rheumatoid arthritis, there's swelling, warmth, redness, and it can often last much longer than 30 minutes, that stiffness in the morning. So both of these conditions can result in pain. They can result in loss of range of motion, so not being able to move as far in in each direction. And it can also lead to weakness, because if you start guarding that joint, trying to prevent the pain, then you're not using those muscles in the same way, and they can atrophy or shrink those muscles. So how do we manage and how do we treat these things? One of the main things you need to do is to manage that pain and get some pain relief so you don't have that muscle guarding. So that can be done many ways. Some people use over-the-counter medications, pain medications. If that doesn't help, you might need a doctor's prescription for something stronger. There's other ways that people can manage their pain through breathing techniques, through movement is very helpful. Some people use acupuncture and massage to help reduce the pain. So that's one of the primary things you need to do. Education helps a lot, to learn as much as you can about these conditions. You want to make sure you mobilize the joints to keep them, to keep the range of motion. So keep moving, keep mobilizing the joints, moving in all directions that you can, but you want to make sure that you work in your comfort zone. That means you're not moving so far that you get the pain. So move in your comfort zone, and then as you feel less stiff, then you can increase those movements. You want to try to manage your weight as much as possible. Even just a few pounds can really increase the pressure on your joints. So you might need to work with your doctor or a nutritionist to help you through that. But if you do have extra weight, try to work on reducing that. Good posture is always helpful in everything that we do. It helps keep our body strong and well aligned, and the muscles balanced. You want to keep being active, but you want to focus on low impact activities. That means you want to try to stay away from running and jumping activities. Look at things that are low impact, like walking. Biking is a low impact activity. Swimming is a wonderful thing. You're almost weightless when you're in the water. Tai Chi is an exercise that many people find helpful because it kind of combines body movements and almost like a meditation. Breathing. Yoga is very similar if it's done in a gentle way. Water aerobics, if that's still available to you, is a great low impact activity. So I hope you think about doing some of these things. Pain relief, I'm just going to review a little bit. Pain relief, mobilize your joints, keep moving, be active, use your good posture. I hope all of these things really help you manage your arthritis if you do develop it as you get older. So we talked about getting moving. So we're going to start with our warm-up and then get our joints and muscles moving. So we always start with a warm-up. I'm going to start by lifting my knees with a little march. And I'm also trying to kind of push my toes into the ground to get my toe joints activated. So we're really trying to activate as many joints as possible. Lifting one and then the other. I'm going to do a few on one side and then a few on the other side. And then back and forth. Nice deep breaths. Get your mind connected. Think about what your body is doing. We're lifting one knee and the other knee. Now let's do 3 on the right and 3 on the left. And back and forth. And you can swing your arms. Everything is kind of relaxed and gentle during the warm-up. And let's start with kicks. So I like to kick across because it gives my hips a little bit of a stretch. A little bit more mobility in the hips. Hips are a pretty amazing joint. They can move in all different directions if you think about that. Knees only go back and forth. Hips can go all the way in a circle. Pretty amazing joint. Same as the shoulder. Very complex joints. So we're kicking across. I'm going to add an arm swing, get the shoulders relaxed, deep breathing. In through the nose and out through the mouth. In through the nose, out through the mouth. And swing your arms a little higher if you're comfortable. Good work. And I'm going to switch to side, stepping one side and the other side. Side stepping. And add an arm swing. So lifting one arm and lifting the other arm. Still pretty relaxed. Getting that heart rate up a little bit, pumping the blood around the body. Anytime you bend your knees a little bit, it activates those quad muscles and it really helps pump the body, pump the blood. One arm and the other arm. Good job. About 5 more seconds, so we change it up. One arm up and the other arm up. All right, now we're going to do a little more of a reach. Reach and reach. Reach and reach. So now we're getting the core involved, a little bit of a stretch in your ribs. Core muscles are posture muscles. Good work. And the core helps support your spine, so we want to keep it strong. Strong and long. We want strong muscles, but long muscles. When you work your muscles in the shortened, where you shorten them, it tends to pull the joints together. And we want to lengthen the muscles to keep those joints open and free. All right. Now we're going to reach forward. Reach and reach. Reach and reach. And we're doing a tap at the same time. Little knee bends. Reach and reach. Reach and reach. Good work. Now let's reach up. And anytime you reach over your head, you'll notice you start breathing a little harder. If you want to take it up a notch, go both hands up. Reach and reach. Very simple movements. Don't use any weights. We're just using the weight of our body. But they work. Reach and reach. And back to the front. I'm sticking with the doubles. If 2 arms are too much, you can go back to singles. Good job. Reach and reach. We got about 20 more seconds. You can do it. Getting that heart rate up means it's an aerobic activity. You're getting the additional benefits of strengthening your heart and your lungs. 5 more seconds. 3, 2, 1. Okay, let's loosen up the shoulder and the spine. So we're starting with a figure 8. Bend your knees a little bit. Starting with a small figure 8, gradually getting bigger and bigger. So thumb pointing down and then back. Big circle in front and then back. So you're rotating around your spine, trying to get bigger and bigger. If it's in your comfort zone, reach all the way to the ground and all the way up as high as you can. I'm feeling this all the way up and down my back. Feels good. And we'll switch arms, starting small, shifting your weight back and forth, and getting bigger and bigger. So we're rotating around the spine and rotating the shoulder. Good job. Getting that synovial fluid moving in the joint. Very important. Like oiling a rusty hinge. Bigger and bigger. 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 All the way down, all the way up. Turning that hand over and over. Good job. Let's try a little bit with both arms. So elbows back, out, and then forward and up. Open up the chest. Elbows back, pull them forward, up, and around. Elbows back. I'll turn sideways so you can see. Elbows back, rounding your back, pulling your arms forward and your back. So you're stretching in both directions, lifting up, and then open the chest. Elbows back, elbows forward, reach, reach, reach in both directions, lifting up, and open the chest. Great job. All right, back to hips. Let's go toe pointing in the front and lifting up in the front. So we're working this hip joint, and we're also strengthening the leg that we're standing on. Anytime you have all your weight on one leg or one limb, you're strengthening that hip. So we'll go 8, 7, 6, 5, 4, 3, 2, 1. And we'll go with flex foot. So you're working the shin up for 8, 7, 6, 5. Try not to bend at the waist. Just lifting that hip. 4, 3, 2, 1. Good work. Other foot. Straight knee. Toe is pointed and we're lifting up. Nice deep breaths. 4, 8, 7, 6, 5. If you can, try to let go of your chair. 4, 3, 2, 1. Then switch to a flexed foot, and for 8 more. 6, 5. Really working your balance. 3, 2, 1. Good job. All right. Now we're going leg to the front and then to the side. So when you lift your leg to the side, make sure your knee is pointing forward, toe is pointing forward, and you probably can't lift very high when you're doing it this way. So front and side, front and side. More hip range of motion. 3, 2, and 1. Let's switch sides. So we're doing a flexed foot, so we're going front and then side, front and side. This gets much harder on your balance if you try it. I'm going to give it a try. Front and side, front and side. Whoop. So you're trying to work up to where you don't have to put your foot down. Whoop. Keep trying, keep trying. Don't give up. There we go. Now I'm getting my better balance. Front and side. Good job. All right, now we're going into a little bit of a plie. So widen your stance, toes are pointing out, a little bend in your knees. And we're gonna start with our arms straight down and lifting up, and then out to the side. And up. Let's go in, up, and out. Up, and pull back. Up, and pull out. Good job. Stay down in that plie if you can. Up and out. If it really starts to ache, you can get up, shake it out, and then go again. Pull back and up. Pull back and out. Pull back and up. Pull back. Forgot where I was going. Pull back and up. All of these are posture muscles. So we're strengthening shoulders. We got this going here, so we're strengthening quads. And we're strengthening the back. Just a couple more. Up and pull back. Up and pull out. All right. Now we're going to go back to the hip, but strengthening the back of the hip, the glutes. So bend your knee, and you're going to push your heel to the back. It's a very small movement, but you'll feel a pretty powerful contraction in your glutes. So we'll go 8, 7, 6, 5, 4, 3, 2, 1. Good job. All right, I think I need my chair for this one. So knees are bent. Keep them even. Heel pointing to the back and pushing back with the leg. Try not to bend forward. That's kind of losing the action of the exercise. So you're just trying to push back the knee, keeping the hip stable. So we'll go 8, 7, 6, 5, 4, 3, 2, 1. Good. All right. Back to shoulders. So we're working the triceps for this next one. So if you want to do a double work, keeping the legs involved, point your toes out, a little bend in the knees, so you're working the quads again. And we're going to push to the front and push to the side and push down, and then reach up. Push to the front, push to the side, push down, and reach up. Let's not keep you down the whole time. So push front, push side, push down, and then straighten up. Push down, front, push side, push down, and reach up. Push front, push side, push down, reach up. One more. Front, side, down, and reach up. Good work. All right. Now we're going to do a little lunge to one side. So a little wider with your stance. Bend one knee. You can even put your elbow on your knee for support. And you're going to reach over as far as you can for 3. And then come up. And reach, 2, 3, and come up. So you really should feel these side muscles activating. So you're reaching, trying to reach all the way from your foot, all the way through your fingers, and then come up. Let's do a couple more. Reach, 2, 3, and up. Reach, 2, 3. Then when we get down here, you can really feel this core engage. You're also working this muscle because you're loading it up. Up, one more. Reach, 2, 3, and up. Good job. Turn your feet so your other foot is pointing out to the side. This one's probably 45 degrees. Bend that knee. You can lean on it if you need to. And we're going to reach for 3, and then lift, reach for 3 as far as you can, and lift, reach for 3, and lift, reach for 3. Feeling this quad load up, feeling your core load up. Reach for 3, and up, reach for 3 as far as you can, and up. One more, and up. Good job. Now we're going to do a similar exercise, but you're going to turn to face that knee. You're bending the knee and reaching with the opposite arm, reaching out, and then lifting up, and over, and then reaching out with the other arm. So we're kind of making a windmill. Up and around. Reach, other arm is back, and then come up, and reach with the other arm as far as you can. So loading up this quad. When you reach out here, you're loading up you're using your core, your stomach muscles to keep you up, and around. Reach, and then push up with your leg, and then reach with the other arm. Feel that quad working, feel the core working, and then push up and around. Good job. Let's turn our feet to the other way. So we're bending this knee, reaching out, other arm is back. So you're making a long line from your foot to your hand, and then pushing up and around. Other hand comes forward, reaching out as far as you can, pushing up, reach out, reach as far as you can, feel it in your ribs, up and around, reach out with the other arm, and push up with your leg, arm comes around, reach, loading up the core, and up, and reach, and up. Couple more, reach, try to go a little lower if you can, up and around, and one more, reach, push up, and around. Good job. So we're working those quads and hamstrings. Let's stretch them out. Toe pointing up. Actually, I'm going to use the chair. I hope you have a chair handy. If not, you can just put your foot out in front and do a stretch this way. I'm going to use the chair. So putting my heel up, facing forward, and bending from your hip. Coming forward a little bit, chest is up. You should feel a nice pull in the back of your hamstring. This is hamstring, you might feel it also in your calf. And breathe. Feels good. All that hip work, quads, hamstrings, glutes. And switch legs. Other heel up. Toe pointing up, bending from the hip joint, not rounding your back because you lose most of the stretch. Coming forward with your chest. Should feel a nice pull in the back of your calf and your hamstring. Deep breathe. In through your nose, out through your mouth. In through your nose, out through your mouth. One more. Good work. A little more stretch through your legs. So I want you to point your toes up and turn your toe out and turn it in. So we're trying to loosen up that hip joint some more. Out and in. You can do straight leg, and you can bend your knee. Same thing. Knee out and in. Trying to get increased range of motion in that hip. And other leg, turn the toe out and in, really working through that hip joint. Tight hip joints can lead to low back pain, so you want to keep those hips nice and loose. And bend the knee, same thing, knee out and knee in, out and in, out and in. Good work. All right, let's get back to a little bit of balance work. So we're just going to start one step forward and one back, forward and back. Try not to use a chair for this. This should be pretty easy, but we'll make it harder. So let's do it without touching. So just bring a knee up in the front, knee up in the back. Now let's go knee up side to side. Knee up, knee up. Trying to stop for just a second in between. Now let's do 3 on that side and 3 on the other side. Just touching. And if you're wobbling and wiggling all over, that's fine. That's your balance reflexes. 3 and 3. Now let's go back to the forward and back. And stop in the middle. And we'll do a little half circle. So start with your toe pointing in front and swing it around to the back. Toe in front, so we're working core and we're working balance. Try not to use your chair. Toe in front, swing it around to the back. Toe in front, swing it around. Other side. Toe in front, swing it around. This side I'm not as good on. This side I feel wobbly. Everybody usually has one side that isn't as strong as the other, so we have to keep working it, trying to balance out. Front and swing around. Great exercise for balance is to try to draw letters with your legs. So let's just try a few of those. Toe is pointing straight out, knee is straight, and let's make an A, big B, whoop, and C. All right, other leg. See, it's really working my balance. So A, B, and C. Great exercise, working your joints in all different directions. All right, let's go tapping in the front, tapping to the side, tapping to the back. Front, side, back, front, side, back. Now try to do it without touching. You can just hold it up. That means you have all your weight on that other leg. So you're strengthening this hip. You're also working balance. If you need that chair, just try to use it less and less. So keep challenging yourself. And other side. Anytime you're standing on one leg, you're strengthening the hip joint, the bones. They've done studies, 1 minute, 3 times a day, standing on one leg actually strengthens the bones, so less likely to have a hip fracture. Keep those bones strong as we get older. All right, side and back, front, side, and back. One more time, front, side, and back, front, side, and back. Let's do a little arm stretch, reaching up with one, reaching up with the other, up, and up. A couple of deep breaths in through your nose, and blow it out. Trying to release any tension that we built up. In through your nose, and blow it out. through your nose, out through your mouth. Little neck rotation. Looking one way and hold. Take a breath. Looking the other way and hold. Take a breath. A little circle with your neck. And a little circle the other way. Trying to always think about standing tall, lengthening. One more deep breath. And blow it out. Thank you for joining me. This is Active Aging with Barb. I hope to see you next time. Bye-bye.